Outside developed countries, children under the age of 5 die every year due to pneumonia.
The greatest tragedy is that this is a disease which is preventable if you've got the basic diagnostic equipment available. It's an easily treatable disease if you've got antibiotics in a health centre.
Now, if you can imagine in a village health clinic in sub-Saharan Africa where there's unreliable electricity, a very low-budget health facility, making the diagnosis of pneumonia is really challenging.
Hospitals in these settings are challenged by many conditions, and I think providing oxygen has been one of those very challenging things to get to happen.
The reason that oxygen is so critical is that it's a therapeutic treatment that can help them combat these very severe symptoms while antibiotic drugs take effect.
For a child who has severe pneumonia, even if they get the antibiotic on time, they still won't recover if they don't have the oxygen.
The fact that they can't provide oxygen for a child with pneumonia, the fact that they can't frequently give the antibiotics that a child needs is, I think, really an experience that no doctor wants to face.
We can't keep saying that it's okay for 1 million kids to die for lack of oxygen.
It's actually outrageous that almost 1 million kids die every single year because of pneumonia. It's something that actually can be solved. There are some simple solutions. We just need to get them to where these kids are.
A problem of this magnitude can't be solved by just one person or one entity. It really takes the collective effort of many people, many entities, with different disciplines and knowledge and expertise coming together. We're blessed that with United4Oxygen, we have so many incredible groups coming together. We can really do something.
The first country targeted for this innovation was Ethiopia. The government and the Ministry of Health had already begun to lay the infrastructure for a roadmap.
The beauty of the oxygen roadmap is that we can look and we can find our area of expertise within that roadmap, and we can say, oh, we can do this part of it. And certain funders can look and say, I have expertise here and I can help there.
Really, now is the time for us to come together in a global campaign that will bend the curve on pneumonia deaths and start driving them down in the way that they can be.
The oxygen demand is getting higher and higher. Despite of this reality, we don't have even one oxygen plant in this 22 million population.
The day-to-day challenge of the hospital is interruption of the oxygen supply. It's difficult to manage when interruption is occurred.
Because of the scarcity, because of the shortage, we prioritize patients to give oxygen.
This patient may survive longer without oxygen supply when it is compared with this patient, so they may probably prefer to give oxygen to this guy.
In all of these settings, we could certainly use additional tools for diagnosing pneumonia.
To solve this problem, we already had done the bulk of the work by inventing what we call signal extraction technology pulse oximetry. The Gates Foundation did a study on about 2,500 children and found that with our technology, they could do this reliably.
For pneumonia, there are 3 things that are important. There's the prevention. The second thing is we need to diagnose it, and then we need treatment. And none of those things are hard, but they all have to be done.
There are wonderful vaccines that can prevent pneumonia, and we're very delighted to see the progress that is being made in this regard.
My dream is just to realize a better health care, a better access, a better quality of service in all aspects.
It will be a great success if there is a mechanism whereby uninterrupted and on-demand based oxygen supply mechanism is assured.
This campaign is really a wake-up call, and it's an appeal to the world to start combating a disease that is leaving literally tens of thousands of children every day gasping for breath and fighting for their lives.